With over 150 cases of monkeypox in Michigan, Oakland County's frontline efforts to get ahead and take precautions against the virus have been a priority in recent months. Joining us now on the Megacast to talk about that and more is Dave Garcia, Executive Director of Affirmations, an LGBTQIA+ advocacy group out of Ferndale, who is also serving on Oakland County's new Monkeypox Task Force. Dave, thank you for joining us today.
Morning.
Appreciate having you on. First time we talked was quite literally the day that the Monkeypox Task Force had been announced in Oakland County. In the weeks and in the months since that has passed, what has been some of the work that's been done on the task force to combat monkeypox here in Oakland County?
Well, we've been doing a lot of work actually. Not only are we meeting every week, just yesterday we had vaccination clinic here at Affirmations. We had over 60 people. This is a handful. We've probably had 5 or 6 now. Every single clinic that we've had, we've run out of vaccine, and we have 3 more next week, Tuesday, Wednesday, and Thursday here at Affirmations. So, right now we are doing our best to get more vaccine into the state of Michigan and then also spread across the entire state, and especially here in Oakland County, where we're seeing both in Wayne County and Oakland County, the numbers are the largest in the state as well. So, we're doing our best to get people vaccinated and get more vaccine here. Most of the vaccine is still coming from Denmark. The national stockpile has gone to Los Angeles and New York. So we need to do a better job of getting more vaccine here. Every time we have a vaccine clinic, we run out. And so as you have probably heard, we've moved from a regular shot or a subcutaneous shot to now the intradermal shot, just under the skin, much like a TB shot. That is to spread the vaccine. Every vial now can be 5 shots if done correctly. And if we can spread that vaccine out, then that gives us some time to get more vaccine into the country, either from Denmark or the new contract that the federal government has just signed with a manufacturer actually out of Grand Rapids, which should bring another 3-point-some million shots into the country to be able to be disseminated. So if we can do those things correctly, and if we can spread the vaccine out now, then the cavalry is coming. But we need more vaccine, and we need it soon.
So in terms of communication between the county executive's office, the Monkeypox Task Force, and the federal government, in terms of when that cavalry may be coming, when that additional vaccine output may be coming to Oakland County to be used in some of these at-risk communities for monkeypox, has there been any timeline put on that in terms of when another rush of this vaccine can make its way to Oakland County?
Yeah, that's a really good question. Let's just take what I just said about the new contract with Grand Rapids. So that, in best case scenario, would be anywhere from 90 to 120 days. And that's best case scenario before that starts to hit the streets, so to speak. Now, the Michigan State Health Department has said that hubs, because remember that when the vaccine gets into our country, then the federal government gives it to the state health departments, and then they decide how to disseminate that throughout their state. Michigan has a handful of hubs throughout the state of Michigan. Oakland County Health Department is one. So is Wayne County Health Department, Washtenaw County Health Department. But to give you some guidance, the entire Upper Peninsula doesn't even have a hub. So how are we getting the vaccine into rural areas throughout our state and in the Upper Peninsula? Well, the state of Michigan has said folks like Oakland County who are going through the vaccine and getting a lot of vaccinations out, like Affirmations, we can ask another hub, if they're sitting on supply, to send it over our way. Well, that's good in theory, but when we call Washtenaw County Health Department and say, hey, you guys are sitting on some vaccine, can you send it our way? Well, they've got the students coming to the University of Michigan. So they're very cautious about what that might look like. And then imagine all the universities across the state of Michigan, much less the little kids coming back to school now that it's fall. So I think people are very concerned about how this might spread, and they're very protective of their vaccine supplies because we are in such short supply. But in some cases, we have had other hubs send vaccine to Oakland County because we are doing more vaccinations than most counties across the state.
And you've mentioned that a lot of these vaccine clinics that you've had at Affirmations, or all these that you've had so far at Affirmations in Ferndale, you've had an output of vaccine there to give to those in at-risk communities in our local area, and every single time you've ran out of vaccine. And that brings up a topic we've also discussed in the past on the monkeypox front, is that there is a significant number of these cases in the LGBTQIA plus community. And so there comes a couple of issues with that. A, how do you protect this community that is statistically at this time more at risk for contracting this virus, while also continuing to put out a messaging campaign that ensures not ensures, but informs the public that this is that while this is spreading at a greater rate in this particular community, this is not an LGBTQIA plus disease. This is a disease that can affect anybody that's making physical contact with another person. What's been done on that front from the county level to prevent some of the qualms from the past that we've had, particularly in the AIDS epidemic of the 80s?
Yeah, and that's a really good point. Monkeypox has been around in Africa for a while now. It's not new. It's not like the COVID uh, vaccine or the COVID virus. And so we've known about this, and in Africa, it's not primarily in the LGBTQ community. And so it got a foothold in our community here in the United States and is spreading in our community. So we have to be very honest about that with our community and trying to keep people safe. Let me give you an example. Right now, all indication is the virus remains in semen even after your lesions have healed for up to 6 to 8 weeks. And we don't know, meaning the CDC does not know just how contagious it remains after the lesions have healed in semen and saliva. And so we have to do a better job of communicating that to our community and to all communities, that even after your lesions have healed, you should be wearing a condom when having sex. And that's not perfect because, as you said, this is not just, this is a sexually transmissible disease. It is not it's not an STI. It can be transmitted through sex. Think of it like, the HIV virus, which you brought up, can also be transmitted through needle use, right? But one really good way to transmit HIV is through sex. And so monkeypox is easily transmissible through sex, but it doesn't mean that that's the only way. And it does not mean that it is a gay disease, because straight people have sex too, and straight people come into contact too. And if we do not get out ahead of this and stop it now and do our best and not allow homophobia or bigotry to get in the way, then hopefully we can get a rein on this thing before it enters into larger and wider communities.
Yeah, it's prolonged physical contact that is the primary way that this is spread, and that is across all communities and all different contexts. And so that's why it's really important to get that particular messaging out there. In terms of in the community that you are serving at Affirmations in the LGBTQIA plus community, given all those factors that go into the spread of this virus, that create those additional risk factors in that community in particular, what then goes into measuring risk? Who should be pursuing a vaccine at this time, and then who ultimately the county will be providing a vaccine to for monkeypox based on that measure of risk?
Well, right now, because the vaccine is in such short supply, the highest risk factors are men who have sex with men, multiple partners. Also extended to HIV positive folks, anybody that is on PrEP, pre-exposure prophylaxis makes sense. And we are now starting here at Affirmations the second shot. So you can get a second shot now at Affirmations. And the CDC is recommending that across the board. So if you are in those categories, then you should qualify for a second shot. Now, that second shot is likely going to be just under the skin. Intradermal. And these are terms I didn't even know about before monkeypox. So that is likely going to be the shot that you get, because we need to spread out the vaccine supply while we can, and while we pressure the federal government and others to get more vaccine into the state of Michigan.
We're joined by Dave Garcia, the Executive Director of Affirmations, located in Ferndale. He's also a member of Oakland County's Monkeypox Task Force, joining us on today's edition of the Megacast. More information from the Monkeypox Task Force can be found on the Oakland County Health Division's website. That is oakgov.com. oakgov.com/health, oakgov.com/health for more information. Dave, got a few more minutes with you. I do want to talk on some LGBTQ issues in the state, or some news in the state. A recent report from Campus Pride's 2022 Best of the Best list had listed both the University of Michigan and Oakland University among some of the most LGBTQ friendly campuses in the entire nation. In terms of creating a more inclusive environment and a more friendly environment for people of all different backgrounds, especially at the university level, how important is it in those particular communities, especially for those in the LGBTQIA plus community, for these universities, for students of all different backgrounds to be putting forth these significant efforts to increase the friendliness of the campus, the inclusion in the campus for all these different communities, and making it not only a more welcoming environment and a more tolerant environment, but a more well-informed environment about the issues affecting these marginalized communities?
Well, I think it's really important. I think back to a good friend of mine, Jim Toy, who's over my shoulder here in my office, who passed away recently and started the Spectrum Center at the University of Michigan, the first LGBTQ student center at any university in the entire country. And back then, they could not, call it LGBTQ or queer or gay. It was something around the lines of, human sexuality and gender studies or something like that back then. And so, Jim just passed away after having started the Spectrum Center at the University of Michigan. And look, if we're going to attract and retain the top talent in the state of Michigan in all areas and all fields, then we have to be more inclusive, and we have to protect legally the rights of LGBTQ people here in the state of Michigan. Otherwise, they're going to go to California, they're going to go to Chicago, they're going to go to other areas where they can raise a family and where they can have a job and not be afraid of losing that job, and raise a same-sex, family without don't say gay laws in schools, for example. And look, in the state of Michigan right now, we are not far from Florida. We have conservative politicians in Lansing that are ready to go with Don't Say Gay, that are ready to go with anti-trans bills in sports, that are just waiting for an opportunity to introduce those bills, and they have the votes. The only thing that is keeping them from doing that right now is that we have a governor who will veto that. And so it is extremely important for us to be vigilant, to get out the vote, and to support any candidate. I don't care what party, as long as they are for equality for all people. We are not asking for anything more or less than what the straight community already has. That's it. That's all we want. Just simple equality, nothing more, nothing less. And if we don't get that in the state of Michigan, to your point, then students are going to go elsewhere. Why wouldn't they? Why would they stay here if they can't have equal opportunity? And so universities like the University of Michigan and Oakland and others who are doing their best to provide equal opportunity for their students, of course, they're going to be ahead of the game and extremely important for the future of our state.
Yeah, some other universities in Michigan that did partake in the index included U of M, Dearborn, Western Michigan, Michigan Tech, Grand Valley State, Wayne State, and Henry Ford Community College. Of course, those are not coming close to the 5-star rating on the index that Oakland University and the University of Michigan did attain. Dave, appreciate your time, appreciate your insight on all of these issues. Anything else that we haven't discussed today, or other issues that you'd like to speak on before we let you go?
I would just say that those universities are also important for monkeypox, because we need to get the word out across the state to those universities as those students are coming into school about how to get vaccinated. Those are congregate settings, and they could become a problem quickly if we don't get the vaccine. Not just the schools, assisted living facilities, the jails. Think about the jails and the prisons and all of the schools that the little kids are coming back to. So back to your monkeypox questions, we have to do a better job of disseminating the vaccine through congregate settings across the state.
Affirmations Executive Director Dave Garcia has been joining us on the Megacast. Dave, appreciate your time and appreciate your insight today.
Absolutely. Thank you.